This is a start. The two issues are access, coverage issues, and cost issues. This bill was limited in the sense that it addressed just one of those issues, the coverage issues. And historically, if you look at what other countries done, they've done exactly the same thing. They've said, let's get everybody in the pool and this worry about cost later. And that's what Massachusetts did. But the lesson is going to be, yes, a good first step in covering 32 million people, but we've got to control the cost in a time of deficit, debt, global competitiveness, taxes going up, premiums likely going up, all of which is going to drive the cost of health care up and not down.
Let's talk in a second about ways to do that. But first of all, Dr. Satcher, you said that this bill's not perfect. What would you like to have seen in there that's not in there?
Well, first, let me say that I'm delighted with this bill because I think it's a very significant first step. I think it's good news for the 32 million people who will be included immediately. I think it's good news and that people will not be dropped from their insurance because they get sick. I think it's good news because people will not be denied because of pre-existing conditions. I'm delighted that primary care will be better supported and even prevention. However, I wish that we will move toward more emphasis on incentivizing prevention. I think we've got to get the schools involved in terms of physical education and nutrition. I think every family needs access to safe places to be physically active and fresh fruits and vegetables. So how do you do that? You have to partner with the social determinants of health. But I'm delighted that we have made this great first step.
All right. Some people argue that prevention is one way to lower health care costs because healthy people use less health care. Dr. Frist, what else would you like to see done to contain the cost of health care? Our Dr. Sanjay Gupta last week talked with the CEO, the former CEO of the Mayo Clinic, which has, like the Cleveland Clinic, a new model where everybody's on salary. You pay to treat the disease as opposed to piecemeal fee-for-service type of things. Is that a model that can go forward, or have you got some other ideas?
Yeah, no, I think it's very important, and now is the time to focus on these costs because they're going to start just skyrocketing right now because 32 million people now are going to have plans, are going to be spending a lot more at no constraint. First of all, I agree with what David said. Let's look at prevention, wellness, behavior. Michelle Obama's initiative is not going to use government. It's going to use a public-private partnerships. That's the way to go there. I would look at some obvious things. Tort reform, we hear it again and again. Is it the most important issue out there? No, but it does affect doctor behavior, doctor-patient behavior, defensive medicine. Number two, I would go ahead and open up the insurance markets to more competition. There's not that much competition, market-based reform in this bill, and at the end of the day, I think consumers are smart enough if they've got good information in a regulated market. So being able to shop across state borders, I put number two. Number three, and I think in truth it's probably number one, is what you mentioned. We need to have a lot more payment reform. Only by having payment reform are we going to be able to align the incentives of the patient, the consumer, the doctor, the hospital, the wellness programs. Right now, it's a free-for-all. Everybody's billing everybody. It's fee-for-service. There's no incentive out there to align around a goal of value with value-based health care reform. Now it's all volume-based. The more you do, the more you get, the more money that's spent in the system. So I would have put in this bill a lot more focus on aligning interests around value-based reimbursement.
Right. Dr. Satcher, Dr. Frist mentioned this idea of the public-private partnership that arises out of the health care bill. Now that the bill has passed the House and looks like it may pass the Senate with the fixes, what needs to be done to ensure that that public-private partnership actually works?
Well, I think the national exchanges certainly allow for public-private partnerships, and obviously they have to be monitored. The Surgeon General will have a responsibility for looking at what constitutes the components of good care. I think that's going to help. Together, we have to make this work. It's obviously not going to work without a lot of input from people who care. But I think this tremendous first step is really great news for this country, and it changes our position in the world. It changes our relationships to each other. And for those of us who come from backgrounds where we didn't have access to care, it's a great day in America. And so it's
But Dr. Satcher, you also have some other concerns. Congressman Jim Clyburn called this the Civil Rights Act of the 21st century, but you're concerned about some racial and ethnic disparities still lingering out there in health care? What are your concerns?
Right. As Surgeon General and Assistant Secretary of Health, I led the effort to develop the goal of eliminating disparities in health. And the first thing I want to say is that universal access to care is critical for eliminating disparities in health. We've got to have more minority physicians. The healthcare system has got to be representative of the population. And we've got to have initiatives that respond to the unique needs of different cultures in our society. We have some real opportunities here. This is a great first step.